Helderberg Medical Forum is proudly brought to you by Cure Day Clinic, Somerset West. Ask your dentist, surgeon or doctor about the Cure Day Clinic or phone 021-824-1240. Cure Day Clinic, specialised day surgery.
10 o'clock on a Friday, then you know it's time for our medical forum. And in the studio, I have Dr. Jonathan Toogood. I was going to say feel good. I got confused here. Good morning, Jonathan.
Good morning, Anelia.
I asked you off air and you said that really is your surname, Toogood.
That is true, yes.
Don't you often get puns on that?
Oh, frequently. I've been Dr. Feelgood, Dr. Good Enough, Dr. Goodbody. So when you grow up with a surname like Toogood, you become accustomed to people getting it wrong, so it really doesn't bother me. You may call me what you wish.
I will. But, especially in the line of the medical profession that you are, you must get a lot of that because you're a plastic surgeon and you're in the cosmetic and reconstructive surgery business. So here is Dr. Toogood. That's quite something. Now, first of all, let's start off. Why did you pick to become a plastic surgeon?
Well, I think, Anelia, like most things in life, there's a short answer and a long answer. The short answer is that plastic and reconstructive surgery encompasses all the things that I enjoy and that I find gratifying. I knew all along I was going to be a doctor from the youngest age, and that I'm still quite old-fashioned in that respect. I still feel that medicine is a calling. It's something that you're called to, and it's philanthropic by nature, and it's a ministry. As a result of that, I knew all along I was going to be a doctor, but there was something inside me that needed artistic and an expressive side, which medicine doesn't really give you much opening for. And plastic surgery, you can imagine, has a very creative side. It has an architectural and engineering side. So all the things that I enjoyed, I always felt I was fairly good with my hands, and that I loved planning and in 3 dimensions, seeing how something would turn out according to the plan that I'd created. And plastic surgery just combines medicine, which is a healing calling, and the artistic, expressive side of my personality so well. And it's rewarding in so many different ways. Patients always associate you with the time possibly after their diagnosis or after the thing that bothered them when they made the decision to take charge of it and make it better. Mm-hmm. They associate you with the improvement rather than with the dread diagnosis or the illness.
That's right. Now, I don't watch that many TV programs, but I have seen especially the American ones where they do the tummy tucks and the facelifts and the nose jobs and stuff like that. So what is the difference between a plastic surgeon, a cosmetic doctor, and what was the other one, the aesthetic practitioner? What are the differences?
Well, it's important that one realize that a plastic surgeon has a 5-year specialist degree after their basic medical training as a GP, as a general practitioner. So it is a specialist surgeon's degree. This allows the Department of Health to register you as a surgical specialist, and they basically rubber stamp any surgical procedures within the realm of what you are specialized in. They say you are entitled to perform that, and they say you are safe. So a plastic surgeon is a specialist.
Okay.
An aesthetic practitioner, it's a very vague term. There are general practitioners performing aesthetic medicine. There are non-doctors performing aesthetic medicine. There are people in allied sciences such as dentistry and even nursing practitioners who are performing aesthetic medicine. So it's very broad. I take quite a hard line on this because if patient safety is, as it should be, our primary concern, then you need to be sure that the person or the environment in which you are having your procedure or surgery performed is, first of all, a safe one, and that the person who is administering your treatment is registered, licensed, and trained and qualified to be doing that. So a plastic surgeon is the only person you should be going to for anything of a surgical nature. And please bear in mind that things like liposuction are not office procedures. They are surgery and need to be performed by a surgeon. Aesthetic practitioners do the allied sciences, things like your injectables, the very in vogue Botox and filler. This doesn't mean that plastic surgeons don't do that. A significant amount of my practice is I'm fairly biased on this front. I feel that if you have the option, go to the person with the highest level of qualification that you can. That will give you the best chance of a safe, pleasing, aesthetically appropriate result. That's not to say that there aren't good non-specialist aesthetic practitioners out there. I'm certain that there are, and I know a number of them. But when it comes to surgery, there is no compromise. A surgeon in a surgical environment, in order that what is done is safe.
Absolutely. Otherwise, you will read in one of these magazines, you'll become a picture with I've seen them, the one eye drooping, or some strange side effects that happened. And I suppose if you do go and have a good investigation, you'll find out they didn't follow, as you say, the right surgical procedure.
Well, of course. I think the surgery that makes the headlines, or the aesthetic procedures, with the whole aesthetic medicine discipline being so in vogue at the moment, the surgery that makes the media and the press, or the procedures that reach the media and the press, are usually when things don't go to plan. For every one that's not optimal, there's probably 50, 100 or more patients who are perfectly happy with what they've had and are getting on with their lives without saying another word about it. So I do think that the media is possibly slanted in the direction of sensationalism, and they like, we all, why do we rubbernecked accidents? People like to see things that give them a bit of adrenaline. So people watch these programs with the idea that complications and adverse outcomes are the norm. They are certainly not the norm. Definitely not in the realm of plastic surgery performed appropriately by appropriately qualified people.
Well, in my mind, there's no doubt that the media loves the sensation. I mean, they seldom report the feel-good stories.
Certainly.
So now, when a patient comes to you, and I suppose it's not just ladies, it's men as well, what is the most common thing they come to you for?
From a reconstructive point of view, I see a lot of skin cancer. We are, of course, an outdoor society, and here on the southern tip of Africa, the sun plays a constant role in our lives. And skin cancer, the cure of skin cancer, and the reconstruction of the defects resulting from the skin cancer excisions are still very prevalent in our practice, and it's something that I find rewarding. It's not just good enough to cut the cancer out, but one must reconstruct the patient to the point that they look as good as they did before they got the diagnosis. The other reconstructive aspect that we deal with on a daily basis is breast reconstruction following a diagnosis of breast cancer. Okay. And this is an ever-increasing pandemic in our environment. They say that the lifetime risk of a woman to develop breast cancer is now 1 in 9. And in the past, where breast cancer meant mastectomy, hopefully survival in the first case, but then mastectomy and an awful scar on an asymmetrical chest, often with radiotherapy burns, etc., where that was the norm. Breast cancer is now not only a curable but a reconstructible condition where we can give ladies back their sense of wholeness, their femininity, their symmetry and balance in their torso, and in many, not all, but many instances, even better aesthetically appearing breasts than they had prior to the diagnosis. So we really have moved forward in leaps and bounds, and I am very encouraged by the results that I'm getting with my breast reconstructions.
Just a silly question. If you had a mastectomy, how long do you have to wait? You can't immediately do that. You have to wait for the wound to heal? Or?
Not anymore. Not anymore. In the past, it used to be diagnosis, mastectomy, chemo and or radiotherapy, let things settle down, and then reconstruct a year or so later. Probably 80% of the patients who we are treating on a weekly basis, and when I say we, I mean the general surgeons and myself, are patients where we are performing either unilateral, one side only, or bilateral, immediate mastectomies and immediate reconstructions under the same anesthetic. So the patient goes to sleep with 2 breasts, wakes up with 2 breasts, and their cancer is hopefully surgically cured. They may still need chemotherapy or something such like, but it's no longer the norm that patients need months and months or years to first wait without a breast before they can have reconstruction.
I think it's less trauma as well. You go through it once, it's done, and then you recover.
Absolutely. It also gives me as a surgeon the best opportunity to give patients symmetry, because if we're doing the same procedure on both sides, particularly in the setting of a bilateral mastectomy and reconstruction, we can give the patient not only immediate but durable symmetry that will last for the duration of their lives, hopefully. Aesthetically speaking, coming to the second part of your question, this is very, very broad, and it's age group dependent. In the young marrieds, We're doing a lot of the so-called mommy makeover, which I think we're talking a little bit about later, which is aesthetic breast surgery, be that a breast lift, a breast reduction, breast augmentation, or combinations of the above, with some form of abdominal aesthetic surgery, tightening of the abdominal muscles and removing of a little pouch following pregnancies, liposculpture and liposuction, which are on a continuum of the same procedure, are still very, very common. And then in terms of facial rejuvenative or cosmetic surgery, I do lots of facelifts on your slightly more senior set, patients from their 50s onwards, and lots of eyelid rejuvenative surgery. And this is an area in which males are approaching me for surgery far more frequently than in the past. You know, the tired, hooded eyes. I think your businessmen are wanting to appear authority figures and strong and powerful in business, and there's nothing that makes you look less convincing than a tired, hooded eye, or a bag underneath the eye. And so eyelid aesthetic surgery is very common. The old mainstays like rhinoplasty, etc., and the nose job, as it's commonly known as, are still also very common. So really, that's what another thing that attracted me to plastic surgery in the first place is the tremendous diversity that you get to deal with every day.
Yeah, and every person's different.
Completely. There are no two operations, be it an eyelid surgery, a rhinoplasty, or a facelift, that are identical. And that, I think, is also getting back to our question about surgeons versus non-surgeons. If you've had appropriate training and you have a properly attuned aesthetic eye, you are not going to be doing a cookie cutter approach to your patients. You're going to be applying appropriate surgery for each individual patient based on their requirements, not based on some color by numbers pattern. So yes, it's constantly interesting and always challenging.
I can hear you're very passionate about your work. I'm speaking to Dr. Jonathan Toogood. Now, you mentioned a mommy makeover. Now, Sunday is Mother's Day as well, so the mommies are listening. What is a mommy makeover?
Well, by definition, a mommy means that she has had children. So as rewarding and amazing a life phase as it is, having and raising children, there can be no doubt that it takes a toll on a woman's body. And following pregnancies and breastfeeding, the norm that we see, particularly the so-called second baby syndrome, where ladies really struggle to regain their figure after their second pregnancy, particularly if that's coupled with a cesarean section or two, is that the post-breastfeeding breasts are either a different size to what they were prior to the pregnancies, or else they're in a different position to where they were prior to the pregnancies and breastfeeding. So breast surgery is one of the always ever-present elements of a mommy makeover. So this may be either a breast reduction if your breasts have enlarged following breastfeeding, a breast lift if they have merely migrated south following breastfeeding, or else a breast augmentation, adding volume back, as some ladies develop what we call post-lactational mast atrophy, loss of breast volume following breastfeeding. And these can be combined. So you don't need to just have an augmentation. You can have a lift and augmentation, or a lift and reduction, or just a reduction, just an augmentation. And the goal here is, again, not to make you look like a tabloid newspaper
movie star
article, yes, object of paparazzi interest, but more to give you back the symmetry and balance on your torso that you ideally would have, or possibly that you always wished you'd had before your pregnancy. So to make you as appropriate and as balanced as we can. The other mainstay of the mommy makeover is always the abdominoplasty or tummy tuck, which also encompasses a very broad number of potential operations. It can be removing a bit of skin and fat. It can be tightening the abdominal muscles. It can be doing both the above mentioned. And there are various different combinations of procedures which are all grouped under the term tummy tuck. But it's not only getting rid of skin and fat that's in excess or in removing cesarean scars, etc., but it's restoring your core stability. And so many women come to me saying, yes, I'm bothered by how the tummy looks, but what bothers me most is the tremendous hollowing of my lower back and my constant backache. And in the majority of cases, backache and posture are dramatically improved by a well-planned and well-performed abdominoplasty or tummy tuck. So we give the ladies back not only their shape and contour, but we improve their exercise capacity. The strength and their core stability is returned to them. So the ravages of pregnancy and breastfeeding and rearing children, we can reverse many of them with the mommy makeover. Obviously, lipo-contouring of the thighs, etc., may also form part of this bouquet of procedures. So it's a very broad and all-encompassing term, but the mommy makeover patients are universally exceptionally happy in that they regain something that's been a toll that's been taken on them has been reversed by performing a mommy makeover.
Yeah, and it's not always just vanity. It has got to do with your health. I've had 4 babies, and it's sort of, as you get older, you sort of think, oh well, gravity's winning, this is happening, but you have no choice. That's the way it's going to go. But now, the average downtime, if you come for your breast augmentation, and I'm sure that it's all safe. A couple of years ago, well, more than a couple of years ago, there was an outcry about, I think it was the silicone.
That's correct.
What do you call those?
The prostheses. That's a long conversation, but if I can give you the condensed version, there was speculation that breast implants were making women ill. And that has been conclusively disproven. The breast implant per se is not a risky article. They have been tested and retested and found to be completely safe and biocompatible. The problem was that the patients with the symptoms had infection or bacterial colonization, biofilm around their implants, and this was giving them strange symptoms. With the advances in implant technology in recent years, you can now get implants that biointegrate, the ones that I use, which cause absolutely no systemic response from the body, and also they are resistant to things like infection and encapsulation, so the breasts also won't go hard as many patients had seen in the past with breast augmentations. So that whole controversy has been cleared up, and the breast implants are not to blame.
So if you've had a procedure like that, is it like a major, like having a cesarean, that a couple of weeks you're not allowed to drive or lift up things? How serious is it?
Well, it is surgery, and as you said, we're assuming that it's safe. And I'm going to go back to the point before. You need to make sure that your procedure is being performed in a licensed, registered facility by a licensed, registered practitioner, because anything can be unsafe if done in the wrong environment by the wrong person for the wrong reasons. On the incorrectly selected patients. So that's why we use our facility, Somerset Aesthetic Surgery, which is a licensed and registered day hospital. And I'm not here to promote the facility, but just to let people in the area know we are a licensed registered hospital, and we are meticulously tested and inspected regularly, and your safety is as guaranteed as anything in medicine can be in our facility. Getting back to the downtime question, it once again depends on what you're having done. An abdominoplasty will keep you out of action for longer than breast surgery will, because we are working on your muscles. We are giving you core stability by repositioning your muscles, not cutting through them, mind you. People often ask me that, are you cutting through the muscles? No, I'm quilting them towards the midline and restoring your core. Because of that, every time you cough or sneeze or try and stand up out of a chair, you will have a degree of discomfort. Much more than you would in breast surgery, for example, where we are working above the level of the muscle in most cases, and where recovery is quicker, where it's not a mobility impairing procedure. Having said that, our patients spend 1, sometimes 2 nights in our facility during their post-operative period, and after that they return home. The question about driving, I think this is a much misunderstood issue. Many patients are told you can't drive for 6 weeks. My take on it is you can drive as soon as you can get in behind the wheel of your car, because whether you're the passenger or whether you're the driver, it really doesn't take any more effort. Yeah. As long as you are comfortable, you can do what you feel comfortable to do. The body is clever. It will warn you if you're being excessively adventurous in your post-operative activity levels.
Listen to your body.
For sure.
Now, you said the questions that you should ask your plastic surgeon before you consider an augmentation. And obviously you go for advice, and I know they measure you and they take photographs and they chat to you. From the patient's side, what should they ask?
Well, I often preempt this when the patient walks through the door, because most people come with a printout from Google or notes written at the
Google.
True, yes. A source of lots of information, sometimes misinformation, sadly. the three groups of questions that breast augmentation patients always want to know is silicone versus saline. Okay. Now, saline implants have almost disappeared from use because they are no longer necessary. In the United States, when there was doubt about silicone implants, saline was all they had available. So for almost 30 years, only saline implants were used. In retrospect, we now see for no good reason. So I use silicone gel implants with a polyurethane foam coating. This makes them biointegrate and become part of your body. They're no longer a foreign substance lurking within the body. They are biocompatible.
So, sorry to interrupt. So after 5 or 10 years, it doesn't need to be replaced.
No,
That's
absolutely
there forever.
not. Absolutely not.
Okay.
The implants are also made of a cohesive gel. So even if you were to intentionally poke holes in the implant, nothing will leak out because they are a cohesive gel. So the thought of something foreign coursing through your lymphatic system is also no longer an issue with the current generation of implants. The other question that ladies always ask is above and below the muscle. And, to this day at congresses, there are heated debates as to whether you should place the implant below or above the muscle. My personal approach is that your breast belongs in front of the muscle. So if you can place an implant in such a way that it won't be visible, that it won't be palpable, that it appears and moves naturally, then with the envelope that you are working with, the breast envelope and the amount of tissue cover that you have, then in front of the muscle is definitely the plane of choice. And then, of course, people want to know, where are you going to cut? Are you going to go through the armpit? Are you going to go through the navel in Dr. Ray's style? Are you going to go from the crease underneath the breast or around the nipple? In my practice, the crease underneath the breast is the least visible, least bothersome, and most accurate access route to the prepectoral plane, the plane at which you want to place the implant. So that's my plane of choice and my incision of choice. You will find different preferences out there. All I can say is that the results that I achieve with my approach are very gratifying, and I don't have any patients who subsequently have said, gee, I wish you'd not made the incision there, or gee, I wish you'd placed the implant under the muscle instead. It's about things appearing natural and moving naturally, and not the other little rhyme that I sing 20 times a day is, if the surgery draws attention to itself, it's incorrect. It's been done wrong. Surgery mustn't be that visible that a lay eye can pick it up. It must optimize and harmonize the way you appear. And not only statically, but in positions in movement as well.
Must be natural.
Absolutely. It's no good that the breast looks pretty when you're standing still, but every time you exercise in the gym, it bounces around because the muscle's pushing it where it doesn't belong.
I'm laughing. I can just see that picture in my head.
Well, you see it. You see it daily in the gyms. If you look carefully, you know what to look for. So
I'm sure you know what to look for. I'm chatting to Dr. Jonathan Toogood. And Jonathan, the time is sort of catching up with us, but where can people get hold of you? I'm sure there's lots of ladies who's got now lots of more questions and they'd love to chat to you.
Certainly. Well, my practice is based at our privately owned and operated day clinic, Somerset Aesthetic Surgery. We are in Arran Place, which is on Old Solari's Pass Road, just below the intersection. And our contact details there, our telephone number is 021 851 3400. You could also go to our website, which is www.somersetsurgery.co.za. Or else you can Google either my name or else our clinic's name, and we'll be high up on the search engine, which will lead you then to our website. So you're welcome to contact us by any means, telephonically or by email.
And if they Google you, it's Dr. Toogood or
yes.
Dr. Anthony Toogood?
Jonathan Toogood, yes.
Jonathan.
And that's it'll come up on any Google search. Also, my clinical practices website is www.drtoogood.co.za. One word.
I just love this name, Dr. Toogood. Well, you are too good. Well, thank you for the chat. I really enjoyed that. And I think there's, as you said earlier, the media slants towards sensation. We all know that. And there's all these myths going around, and people scare each other with the Dr. Google knowledge. So
absolutely.
It's grand to hear it from the experts. So thank you so much for coming in.
Thank you very much, Anelia. Appreciate your time.
Have a wonderful day.
Good. You too. Take care.
Helderberg Medical Forum was proudly brought to you by Cure Day Clinic, Somerset West. Ask your dentist, surgeon or doctor about the Cure Day Clinic or phone 021 824 1240. Cure Day Clinic, specialized day surgery.